we are focused. We know what we are doing. We will not succumb to what is in social media.
We are being scammed by people who know what they are doing. It's not accidental.
Wanasema wakati ambapo shirika la SHA linatoa pesa kulipa hospitali kushi, hospitali hewa, wanasema Sifuna anyamaze tu.
In Kenya, a healthcare scandal is unraveling, exposing a web of fraud that threatens the nation's dream of universal healthcare. Billions of shillings allocated to the Social Health Authority SHA have been funneled to non-existent hospitals and facilities with dubious ownership, sparking outrage across social media and prompting a fierce government crackdown.
We cannot continue using a system that is clearly a process of crime. It appears that the only people for whom SHA is working are the ones who are getting these commissions, the 2.5% from my monthly contribution. You have told us that they have to be paid on a daily basis. And yet the facilities themselves do not get similar treatment when they ask for reimbursements for their claim.
On August 25th, 2025, Health Cabinet Secretary Aden Duale addressed the nation responding to public complaints about the misuse of funds under the Social Health Insurance Fund SHIF and Primary Health Care Fund, collectively known as TaifaCare.
On SHA, and we are very, very categorical. We are focused. We know what we are doing. We will not succumb to what is in social media. We will give the people of Kenya the true facts as they are, and we shall continue. I have called this press conference today to provide a very comprehensive update on our relentless effort and fight against fraud, and to address recent discussions, including those on social media and from various professional associations. Our position on safeguarding public resources has been very consistent, clear, and unwavering.
Since its rollout on October 2024, TaifaCare has processed claims worth 91.7 billion shillings from hospitals nationwide. Of these, 60.7 billion shillings has been paid out, with 6.4 billion shillings approved and awaiting disbursement, but not all claims are legitimate.
The claim status for PHC, or the Primary Health Care Fund, which is free, which Kenyans access at level 2, level 3, and level 4 outpatient, and paid for by the government under the leadership of President William Ruto. The total claims submitted since October 2024, health facilities have submitted claims totaling 9 billion shillings to SHA. The total claims paid, SHA has paid out of that 9 billion, 7.7 billion to health facilities. We have the health facilities, their names, their bank accounts, and we can account for every shilling we have given to them. The balance, which is 1.3 billion, will be paid in the next payment cycle.
Duale revealed that 10.6 billion shillings in claims have been rejected due to fraudulent practices, including upcoding, falsifying medical records, converting outpatient visits into inpatient admissions, and billing for non-existent patients. Another 3 billion shillings in claims are under re-evaluation for missing documentation, while 2.1 billion shillings are under surveillance for potential fraud.
Total claims rejected, and we shall give you the reasons why they have been rejected. Because the biggest issue we are facing, which has bedeviled the former NHIF, is fraud. Claims worth 10.6 billion have been rejected due to fraudulent activities and non-compliance. This action is taken under the authority of Section 48(5) of the Social Health Insurance Act 2023, which outlines penalties for providers who knowingly or fraudulently alter information to defraud the authority.
The Ministry of Health has deployed an AI-powered digital system to flag irregularities in the claims process, uncovering shocking malpractice, For instance, Duale Hospital in Bungoma County was caught submitting falsified maternity claims alleging multiple cesarean sections on the same patient within days, an impossible feat. In Homa Bay, Kotiende Medical Center produced fabricated clinical records with one individual signing off for both day and night shifts over consecutive days, defying logic. These actions violate Section 48(5) of the Social Health Insurance Act 2023, which imposes penalties on providers who knowingly falsify information to defraud the SHA. Duale emphasized that the ministry's AI system is designed to detect anomalies at every stage, ensuring fraudsters cannot outsmart the system.
On ensuring transparency and social accountability, we are committed to transparency, and that's why we have continuously published the list of health facilities paid by the Social Health Authority, even though we are not legally required to. This public-face approach ensures the public can hold us and healthcare providers accountable.
Duale's pressure comes days after the Rural Private Hospitals Association of Kenya RUFA blown the whistle on an even more brazen scheme.
Every shilling, I repeat, every shilling contributed to the Social Health Insurance Fund must go towards legitimate, life-saving healthcare for the people of Kenya.
The financial stakes are staggering. Under the Primary Healthcare Fund, facilities submitted 9 billion shillings in claims, with 7.7 billion shillings paid out. For the Social Health Insurance Fund, claims totaled 82.7 billion shillings, with 53 billion shillings disbursed. The rejected 10.6 billion shillings represents a significant blow to fraudsters, but also highlights the scale of the problem, with Kenya's 30% fraudulent medical payout rate doubling the global average of 15%.
The healthcare fraud is a global problem, draining an estimated 3 to 15% of the healthcare expenditure annually. In Kenya, the Association of the Kenya Insurance, AKI, reports that fraudulent claims account for 30% of all payouts. It isn't just a challenge for us at the Social Health Authority and the Ministry of Health, it's a systemic menace. Our rigorous enforcement is a necessity, and let me say it's not an option.
Duale's crackdown is gaining momentum, with 728 non-compliant facilities closed and 301 downgraded by the Kenya Medical Practitioners and Dentist Council. The SHA has suspended 40 facilities and plans to degazette 45 more, but public trust is wavering, and social media campaigns are demanding accountability for every shilling lost to ghost hospitals and fake claims. The ministry now is calling on Kenyans to report suspicious activities through the SHA's toll-free number 147. As investigations continue, the fight to save TaifaCare hinges on rooting out corruption and restoring faith in Kenya's healthcare system. Can the government and citizens together stop these fraudsters, or will the dream of universal healthcare collapse under the weight of greed? Newsroom, Maisha TV, Reader Kering Chebet.